Pregnancy Part 1. The conceptus becomes a solid ball of 12 to 16 cells called a morolla, and it resembles a mulberry by about day 3 to 4, and it floats freely in the uterus. The outer layers of cells develop as the trophoblast and will eventually become the placenta. 6 to 10 days following conception, the trophoblast will then implant in the uterus. And it has to be in the right place at the right time for normal implantation to occur. The best place for implantation to occur is the upper uterus because it has a rich blood supply and it's optimal for fetal gas exchange, nutrition, and waste elimination. In the upper uterus, the lining is thick and it prevents the placenta from attaching too deeply, so it facilitates easy expulsion after full-term birth. And it also limits blood loss after birth because of interlacing muscle fibers. The blastocyst is the inner cells, and they become the embryo. The placenta is where transfer of fetal waste and maternal nutrients will take place. In the early pregnancy, the placenta functions as an endocrine gland, and it secretes estrogen and progesterone. The chorionic villi connect the placenta to the uterine wall, and blood vessels will then develop between mom and the placenta. The placenta will continue growing until it covers about half of the uterus. Optimal function depends on mom's health and her position. The small uterus or decreased circulation can lead to fetal growth retardation, and it can also cause permanent changes in the fetus that may not be apparent until adult life. The placental barrier provides some protection to the fetus, but there are some substances that are able to cross that barrier. So especially with medications, you always want to be certain to have the woman check with the physician to make sure that it's safe to take those medications. Intrauterine development is divided into 3 stages. We have the ovum or pre-embryonic, the embryo, and the fetus. The embryonic stage lasts from approximately day 15 through the 8th week of pregnancy. The development of specialized structures is controlled by 3 different factors. Number 1 is genetic information in the chromosomes received from the parents. 2, interaction between adjacent tissues. And 3, timing of the interaction between the tissues. Amniotic fluid develops initially by diffusion from the maternal blood. Additional fluid is then added from the fetal respiratory and gastrointestinal secretions. The fetus will be able to swallow amniotic fluid, and fluid travels in and out of the lungs, and by week 11 the fetus will begin to urinate into the fluid. Now don't get grossed out because all of this is sterile. Amniotic fluid functions are that it helps the fetus contain constant body temperature. It is an oral fluid source and repository for waste. It helps the fetus maintain fluid and electrolyte balances. It cushions the fetus. It's an infection barrier. And it helps prevent the fetus from getting tangled in the cord. Oligohydramnios is a small amount of amniotic fluid, less than 300 mL, and it may indicate fetal renal abnormalities. Hydramnios is elevated amniotic fluid amount, more than 2 liters, and it may indicate gastrointestinal abnormalities or other malformations. The umbilical cord will begin development by day 14 following conception. During the 3rd week of gestation, blood vessels develop and begin to provide nutrients and oxygen. 2 arteries carry blood from the embryo to the placenta, and in the fetus this is unoxygenated blood. And these are the smaller vessels. 1 vein carries blood from the placenta to the embryo, and this is the oxygenated blood. It's the larger vessel, and there's only 1 of those. As the cord develops, it is covered by a connective tissue called Wharton's jelly, and this will help prevent compression of the cord in utero. A cord wrapped around the fetal neck is referred to as a nuchal cord. This might help demonstrate fetal circulation a little bit better. Most of the fetal blood is diverted from the liver and lungs in utero by three circulatory shunts. We have the ductus venosus, the foramen ovale, and the ductus arteriosus. After birth, the shunts will then close as the newborn begins to cry and breathe by increasing intrathoracic pressure. Another graph to kind of show you the gestational growth of the fetus. Fetal development is the longest period of development. It's 9 weeks after conception to birth. At 4 weeks, at this point of development, the structures that eventually form the face and the neck are becoming evident. The heart and blood vessels continue to develop, and the lungs and the stomach and liver start to develop. The heart is actually the cardiac system is the first system to really function fully. At 8 weeks, the embryo is now about the size of a grape. It's almost an inch in size. The eyelids and ears are forming, and even the tip of the nose is visible. The arms and the legs are well formed. The fingers and toes will grow longer and more distinct. At 12 weeks, the fetus measures about 2.5 inches and starts to make its own movements. You can see thin, fine hair on the eyebrows and the upper lip called lanugo. And the doctor can hear the fetus heartbeat with special instruments. At this time, the sex organs of the fetus should start to become clear. At 16 weeks, the fetus now measures about 4.3 to 4.6 inches and weighs about 2.8 ounces. The top of the uterus should be felt about 3 inches below the umbilicus or just above the symphysis pubis. The fetus eyes can blink and the heart and blood vessels are fully formed. The fetus's fingers and toes should have fingerprints. By 20 weeks, the fetus weighs about 9 ounces and is about 6 inches long. The uterus should be at the level of the umbilicus at this point. And this is important information. I'm not asking you to memorize a great deal of fetal development milestones, but the information that I'm giving you here is important for you to have a grasp of. The fetus can suck a thumb, yawn, stretch, and make a face. Lanugo, which is a very fine hair, now covers the entire body, and it will thin and disappear as the fetus nears term. Fetal movement generally is felt around this time, and this is called quickening. At 24 weeks, the fetus weighs about 1.4 pounds. It responds to sounds by moving or increasing its pulse. Mom might notice jerking movements if the fetus hiccups. With the inner ear fully developed, the fetus not only hears, but may be able to sense being upside down in the womb. At 28 weeks, the fetus weighs about 2 pounds 6 ounces. It changes position frequently at this point in pregnancy. Scalp hair is now longer than the lanugo, and there's a good chance of survival if the fetus is born prematurely at this time. And at 32 weeks, often on the move, the fetus weighs almost 4 pounds. The fetal skin has less wrinkles as a layer of fat starts to form under the skin, and it will gain up to half its birth weight between now and delivery. And at 36 weeks, fetuses differ in size depending on many factors such as the gender, the number of babies being carried, and the size of the parents. So the baby's overall rate of growth is as important as the actual size. On average, it's about 12.5 inches and weighs about 5.5 pounds. The brain has been developing rapidly and the lungs are nearly fully developed. The head is usually positioned down into the pelvis by now. The fetus is covered with vernix, which is a white, cheesy consistency covering the skin. It's made up of sloughed-off skin that mixes with secretions, and it forms a protective coating over the skin. And this vernix tends to decrease the closer to term. Some terms that are important for you to be familiar with is viability, and this is the ability to live outside the uterus. Term, which depending on which reference you're looking at, can be 37 or 38 weeks to 42 weeks gestation. If I'm not mistaken, your book is 38 weeks. Preterm is a pregnancy past 20 weeks gestation, but ends before the completion of the 37th week of gestation. And postterm is a pregnancy that goes past 42 weeks. So looking at these pictures of fetuses in utero, any idea of how old or how many weeks along these fetuses are? The picture on the left, the fetus is 14 weeks after conception. You can see that the face is more human-like in appearance as the eyes face fully forwards. In the picture on the right, the fetus is 20 weeks after conception. If you look closely, you can actually see lanugo over the body. How about these pictures? The picture on the left, the fetus is 16 weeks after conception. If you notice, the face is more human-like in appearance, again, as the eyes are facing forward, and the ears are beginning to lower to the side of the head. The picture on the right, the fetus is 25 to 26 weeks after conception. You can see deposits of subcutaneous fat over the body, and if you look at the cheeks, you can see some fat beginning to develop. The eyebrows are now appearing, and you can see some vernix around the eyebrows. 1 in 90 pregnancies is twins. Now there's more than one type of twin. We have dizygotic twins, which are fraternal twins. They can be the same gender or one of each gender, but usually they are as different as two siblings that have been born at different times. They are developed by two eggs fertilized by two different sperm, and they have two placentas and two amniotic sacs. Monozygotic twins are 3.5 to 4 per 1,000 births. These are identical twins, and they are the same gender. They develop from one egg. They may have one or two placentas and amniotic sacs. And then conjoined twins are 1 in 50,000 births. They are monozygotic twins, but they have an incomplete embryonic division. They may share organs or body parts, or they may have two complete sets of organs and body parts. Other multifetal pregnancies. Remember that fertility drugs and in vitro fertilization has increased the incidence of multifetal births. Multifetal pregnancies can result in identical siblings, or you may have some identical and some that are not within the same pregnancy, and that is all dependent upon the division of the zygotes. One thing that we need to be aware of is the different infections that can be devastating for the fetus or the newborn. And we remember the worst ones by the word torch. There are a lot of other infections that can cause problems for a developing fetus, such as chickenpox. And there's many substances, once again, that can be ingested by the mother that can be teratogenic to the fetus, or in other words, damaging or harmful. Again, all drugs should be determined if they're safe for pregnant women to take. For example, it is not safe for pregnant women to take ibuprofen, and they must take Tylenol as an over-the-counter pain reliever. And there's many cold remedies that pregnant women are not supposed to be taking. Alcohol and recreational drugs are all harmful to a developing fetus. So nurses must be aware, and they must be passing on appropriate education to pregnant women.